Mr. Chairman and members of the committee, thank you for inviting me to talk to you today about our past work on preventing and reducing Medicare fraud, waste, and abuse. I'm going to talk briefly about 5 strategies where we have identified opportunities for CMS to improve and where challenges remain. And some of these have been discussed earlier. The first one, and one that we believe is very important, is making sure that the providers who enroll in Medicare are in fact legitimate businesses. And so we have supported strengthening provider enrollment processes to ensure especially that some types of providers such as home health agencies and durable medical equipment where the risk of fraud and abuse are higher are legitimate businesses. There has been some progress in this area, but a couple of years ago we were able to set up a couple of fictitious durable medical equipment suppliers that were enabled to complete test billing against Medicare. So we believe that there are weaknesses remaining. Recently 2 things have happened. CMS has done 2 things requiring a surety bond so that they can help recover losses in cases where there is fraud and abuse, and requiring accreditation of suppliers. In addition, competitive bidding for durable medical equipment should help CMS control the number of suppliers getting into the program. Providers have to supply financial documentation to prove that they are legitimate, and that program, as you know, is beginning to start again. The second area I want to talk about is prepayment review of claims. Fewer than 1% of claims are subject to medical review by trained personnel. So that makes it even more important that there are computer edits, sophisticated computer edits in place that help detect improper claims before they are paid. And this will help prevent pay and chase. There's been some progress here, but we believe more would be helpful. The third area is focusing on post-payment claims review. And again, we believe that there should be emphasis on focusing on post-payment claims review in areas like home health agencies and durable medical equipment that are more subject to abuse. The Recovery Audit Contractor program focuses solely on post-payment review, and that has been helpful in recovering payments that should not have been made. But it focused in the demonstration phase mostly on inpatient hospital claims, and we believe that it will continue to focus on that because the dollar value of those claims are higher. But focusing on post-payment review is important. The fourth area is improving oversight of contractors. We did some work on Medicare Part D compliance plans, and we found that of the 5 sponsored we surveyed, not all of them had the required compliance plans in place. As a result of our work, CMS has stepped up its efforts, and we believe there's progress in that area, but that's an important area to make sure that they're conducting rigorous oversight of contractors. And the fifth area, and the last one, is we believe that CMS should have a robust process for reacting to known vulnerabilities in the system. And that is areas where they know there is fraudulent or abusive practices or overpayments, and they have a process in place to respond to that. During our work on the Recovery Audit Contractors, we found that at that point that CMS did not have a process in place to react to the vulnerabilities that had been identified, or a centralized focal point for being responsible for them. Since that time, they have named focal points for that. So we think that's important. Mr. Chairman, that concludes my prepared statement. I'd be happy to answer any question.